So what I'm going to suggest in this session is that there's 5 different types of questions or areas of questions that you can ask yourself to help determine, should I be doing this as a home visit? Should I be doing this as some alternative? So just to help make it a little bit easier for you, I do have an acronym which will be called PLACE, and we'll talk you through what those different things are. But basically the questions that we're looking at is, what is the purpose of the session? Is it something that needs to definitely happen within the home environment? We'll talk about the logistics. So have you actually considered how practical, efficient, or cost effective it is to actually go out to the home? And then you're also going to think about alternatives. So if we're comparing the logistics of maybe a home visit, we're also comparing that against the logistics of some other things, which could be just taking photos or taking videos or a telehealth call or the person coming into the clinic or something instead, or even just referring on to somebody else. So we'll also think about client needs and preferences. So sometimes it could be that actually they're equally efficient, equally effective, but then we need to consider what's the client's culture, what's their preferences, is it appropriate for us to go into the home? And then finally, E is for environment safety. So we need to do some sort of risk assessment. If we're going to go out into the community, even if it looks like, yes, we need to do this home visit for all the clinical reasons and it all makes sense and it's going to be efficient and we're going to get really good clinical information, if there's some risk to the clinician's safety, which would actually make it too unsafe to go out that can't be managed, then we do still need to seek those alternatives. So 5 different areas of questions using the PLACE acronym.